have been doing this all since last 2 days, so I'm not going to dive deep into this. This is going to be just an overview about the common cricket sports injury. As you can see with the pictures, almost every part of your body is prone for cricket sports injury. You name it from head to your toe. So cricket is a non-contact sports. So overuse injuries are very common, and some of the injuries are also impact injuries. Fast bowlers do have higher incidences of cricket sports injuries. Bowlers definitely are more prone for these kind of sports injury. Wicket keepers definitely. Acute injuries are common. Young players are more prone for these kind of injuries, and lower limb injuries are also more prone. So we will start from the upper limb sports injury with the shoulder joint. So shoulder is commonly used for, like, there are many of the overhead activities for the bowlers. So overuse injuries of the shoulder are very common. You name it, this can be tendinitis of biceps, or there can be a rotator cuff injuries. So first of all, we need to understand the term, we call it throwing shoulder. So in whichever sports there is an overhead activity, this particular entity may happen. So any sports, you name it, javelin or baseball pitching or volleyball, wherever there is an overhead activity, this particular entity can happen. So these are different kinds of pathology which can occur in a throwing athlete. You name it, this can be biceps tendinitis or maybe a tear, a slap lesion, superior labrum anterior posterior lesion, or GERD, glenohumeral internal rotation deficit syndrome, posterior impingement, or maybe a rotator cuff injuries. Most of them or all of them are overuse injuries. So we need to understand, although we have seen this picture during this conference many times, so the main culprit is this late cocking phase. So bowler tries to attain, to get the speed, the maximum of external rotation. This is an advantage as well as disadvantage. Gaining too much of external rotation gives a bowler particular speed, but as a result of that, there would be laxity on the anterior side of capsule of the shoulder. What can be the result? There would be more load on the biceps, which can lead to biceps tendinitis. The symptoms would be pain in front of the shoulder, there can be weakness, or sometimes there may be tearing of the biceps tendon if this is going to be overused and neglected continuous throwing. There can be internal impingement. So during that cocking phase with the extreme external rotation, the rotator cuff tendon and back, the posterior part of capsule can get impinged. So that can be within the glenoid cavity and posterior part of humeral head, there can be an internal impingement. This can lead to tightness of the posterior shoulder capsule as well as partial tearing of the rotator cuff. The symptoms would be pain, weakness, and limited range of movement. So this GERD and posterior impingement, they are closely related. So whenever there would be a posterior tightening of capsule, the head of humerus is shifted anteriorly and superiorly. The result would be there would be a lack of internal rotation movement at the cost of extreme external rotation. So the symptoms would be, you can very well see in the picture, the difference between the internal rotation. So the symptoms would be, there can be deep shoulder pain, restriction of movement, and there can be catching, popping, and grinding sounds in the shoulder. There would be definitely reduced shoulder mobility. Sleeper stretch would be the remedy. Slap lesion, as you can understand with the name, this is superior labrum anterior to posterior lesion. The pull of biceps shift posteriorly whenever the head of humerus shifts anteriorly and superiorly. So as a result of that, there would be peeling of the labrum, and the syndrome is known as slap. What would be the symptoms? There would be deep aching pain, there would be say weakness, and sometimes a dead arm syndrome can happen. The remedy, definitely if the slap tear is grade 2 to grade 3, this extend from anterior to posterior, this would require arthroscopic surgical correction. Rotator cuff, as I told you that due to this altered biomechanics, the head shifts superiorly and anteriorly. So there are chances this subacromial space gets lowered. So there are more chances of impingement. This rotator cuff tissue is going to rub more within this subacromial space. So the result could be tearing of this rotator cuff. Although this rotator cuff can also tear with the acute injuries, but in throwing shoulder, this would be overuse injury. So these are preventions. I would skip all these things out. And guys, frankly confessing, whenever you deal a sports injury, this is going to be a combined approach. So for prevention part and for rehab part, definitely I do depend on my physios. So they do understand better on that rehab part and sometimes on the prevention part. And I do intervene whenever surgical intervention is required. Traumatic shoulder injuries, there can be a complete dislocation of the shoulder. Definitely this would be a traumatic. Anti-shoulder dislocation is very common. So there would be a total loss of contact between the glenoid and the humeral head. This is a traumatic injury. What you have to do, you don't never try to reduce this dislocated shoulder on the field. So you just have to immobilize and shift your patient to a proper medical center. Elbow injuries, most of them are overuse injuries. Tennis elbow, which is a very common injury. There are multiple reasons for that. Heavy bat, faulty mechanism. So you can see there would be inflammation of the extensor tendon on the lateral epicondyle, and whenever this injury goes neglected, there may be some kind of tearing also. The treatment depends on which phase of tennis elbow is. This can be a chronic or an acute thing. Sachin Tendulkar, using heavy bats, was very prone for this tennis elbow, and sometimes apart from pain, there can be weakness and tingling also in the cases of tennis elbow. Prevention. This one entity we call elbow overload syndrome. Sometimes people get confused with tennis elbow because everything which is related to elbow is named as tennis elbow. So this is particularly common whenever there is a say improper functioning of medial collateral ligament of elbow and a fault in the technique of bowling. So you can see there are some spurs over the olecranon head, because there's a more of rubbing because your medial side is lax. So the bowler would feel pain immediately after bowling or during the bowling. The remedy would be, say, some of the strengthening, and if the medial collateral ligament is completely torn, then this has to be repaired surgically. Hand injuries are also common. There can be a direct hit of the ball to finger. So this can lead to extensor tendon injury, or this can be a fracture, or there can be a carpal tunnel syndrome. So guys, carpal tunnel is basically a tunnel through which some of our important nerves do travel. So whenever there is a carpal tunnel syndrome, there can be pain, numbing, there can be a numbness and tingling also. Sprained finger, because spinners have to spin their ball a lot, so they twist their fingers a lot. So this sprained finger, again a overuse kind of injury, and a bowler may feel continuous swelling or pain at the time of bowling. So the treatment and the prevention would be the strengthening and some of the technical modifications. Back pain, lumbar spine injuries, a normal layman term, we can call it low backache. This is very common in fast bowlers. So you can see the stress fractures are very common in the fast bowlers because there is a continuous twisting around their core. So if there's a mixed bowling action, suppose they are doing a front on and they change it on side on, and this goes a mixed bowling action, there are more chances of these stress fractures. You can see there is an important structure, we call it pars interarticularis. So this is a very weak part of your spine. So whenever you put a continuous load on that, there are chances for fracture of this pars interarticularis, leading to spondylolysis or spondylolisthesis. Listhesis means this would be a displacement among these spine. Common L4 and L5 spine. So again, what you can do, the technique correction and the core strengthening and avoid overusing all these things out. Sometimes a disc also get degenerated. You know, if you do an MRI of a bowler, you can find even in an asymptomatic bowler, there may be many incidences of lumbar disc degeneration. But every disc degeneration do not lead to neurological symptoms. When neurological symptoms would occur, whenever there would be a lumbar disc bulge, which is pinching on the nerves which are traveling from your spine to say your buttocks and thighs. So symptoms would be radiating pain, lower back pain, muscle weakness can be there. MRI would be gold standard along with some of the clinical examination. And if the tingling is not much, then some of the physiotherapy and some of the medication can work. And you have to rest your player from continuous bowling, so the injury should not increase. In case of say severe neurosensory loss, EHL is weak, so in that cases a surgery would be required. So I think I have to skip some of the slides here because so this the hamstring sprain. We all know non-bowling side is common. The hamstring gets sprained. So very common when a batsman try to do a run up and chances of jumping, hamstring sprains are very common. Similarly, quadriceps strain. Quadriceps is the front muscle. We all know rectus femoris is the commonest muscle. So for the knee, Chirag has already talked about meniscus injury. Anterocruciate ligament injury is also common, not as common as to the contact sports, but whenever there is a twisting and pivoting, the anterocruciate ligament may be injured. So in cases of partial tear, so this is a very important picture. If after twisting injury you encounter this type of picture, so basically this is a hemorrhagosis, that means blood inside the joint. So if after 1 or 2 hours you see this kind of picture, there should be alarm inside your mind that this can be a probable anterocruciate ligament injury. So what you can do, this we all know this rise thing. What are the cardinal symptoms for that? Instability. Whenever your patient or sports person tries to stand immediately after sports injury, after twisting, and if he has sustained a complete anterocruciate ligament tear, there would be a immediate instability. So patient would communicate in Hindi, sir घुटने में लचक आ गया. So there are 2 words, घुटने में लचक आना, घुटने का अटकना. Instability and locking, they are very important symptoms. One is indicative of anterocruciate ligament injury and other is indicative of a meniscus injury. Patellar tendinopathy, overuse injury. Similarly, groin strains. Guys, actually sports injury is a very big topic, so I'm sorry, but so ankle sprains. What happens in the ankle sprain? Whenever there is an inversion injury, this ATFL, anterior talofibular ligament, gets overstretched, and what would be the result? So you can grade your ankle sprain depending on this picture. If you find this type of discoloration and swelling, this is definitely a grade 3 sprain, and in that case, in these kind of findings, you should not say provoke or promote your immediate movement of your patient, because this is a grade 3 injury and there are definite chances of re-injury and worsening this ankle sprains. The treatment definitely conservative. Sometimes in the grade 3 ankle sprains, we have to do this ATFL reconstruction. Severe disease, this happens in the adolescent patient whenever there is a continuous pull over this epiphysis. Posterior impingement, we all know about that. So typically happens in a ballet dancer and a bowlers also. There would be a spur on the back side of ankle, so there would be pain immediately after bowling. Physiotherapy sometimes can help, but if the spur is big, then we have to resect it. Plantar fasciitis, pain on the sole. So in most of the cases, the treatment is again with the help of rehab and some of the footwear modifications. So these are some of the home remedies which a person, a sports person or a patient can do. Stress fractures are also common. Internal hip impingement. So whenever there is an impinging between the glenoid and the femoral head, this can happen. Head injuries, face injuries. So just one thing you should remember during the head injury, if there is a loss of consciousness or amnesia after the injury, this can also happen say 30 minutes or 1 hour after injury. So you should always focus on that. You just should not be flow in a like return to sports quite early. So head injuries are also very serious incidences occurring in the sports. Facial injuries, just give the compression to stop the bleeding. Chest injuries, you can strap. And sometimes when a sports person feel difficulty in breathing, you should go to a higher medical center.
It's actually next.
Yeah, just done.
Yeah.
Thank you.
Okay. Thank you.